and welcome back to this episode of this Healthy Life podcast. I'm super excited for my guest today. I have Dr. Panahpour, and he is one of the most experienced holistic and biological dentists in North America. He also happens to be my dentist for, I think, at least the last 10 years now. So he's doing something right if I keep going back. And he also has so much experience with the detection of infected root canals, cavitation surgery, and he's here to share his story, experience of all the amazing work he's been doing with patients in all the years since 1993. So welcome, Dr. Panahpour. It's a pleasure to have you today.
Thank you so much for having me. It's a pleasure to be here. Thank you.
Awesome. So I'd love for you to start with a little bit of an introduction about yourself, your practice, and how you got into the space of doing more kind of holistic and biological dentistry.
Oh God, I can probably write a book on that one.
It's a whole episode on its own.
I guess in a nutshell, I realized really early in my dental career that what I was being taught to be this kind of drill it, fill it, bill it type of a dentist, it wasn't going to work for me. That's just not work for me. I'm a very curious individual. By nature, I'm a creator, and I always, I was blessed to be able to see between the lines, is what my grandmother called owl medicine. You know, the owls can see further than any other animals. So I was kind of blessed with that. So I really early in my dental career, I know that this wasn't going to be for me. I wasn't going to be the drill it, fill it, bill it type of dentist. And I knew that dentistry had so much more to offer. And to make a long story short is during my continuing education years where I got to acupuncture, I was accepted into a program at Columbia University, electroacupuncture cardiothoracic by Dr. Omura, a very advanced physician. And that's where I really saw how the body works and how dentistry, this cranium, this engine, was so important for our health, well-being, structure, et cetera, et cetera. So that's really, in a nutshell, that's really where it started from.
Yeah, and I think it's so important to kind of recognize that, you know, like we think of our teeth as this separate organism in our body, but it's so connected to so much, our gut, our neurological system, and just so much that's impacted by what's in our mouth.
You know, we were taught this, you know, teeth, whatever, you know, but so what I was preaching 25, 30 years ago, where I was being laughed at, where I was being attacked by different organizations, now all the research has proven everything. So it's kind of funny to sit back and see that. It's like, I had to go to court, I had to protect my license, and now the research has proven everything that I talked about, you know, those so many years ago. So it's we're in a new era now, you know, of medicine. I think, thank God for the internet. In a way, thank God for COVID. I'm sorry I have to say that, but it really raised our awareness that you got to do your research. You got to go above and beyond of what this person's telling you. For example, you know, diagnoses. You know, everything has a diagnosis this way. Let's look at the word diagnoses. Well, die means to, and phonetically means to die. And agnosis, if you ever look up the word agnosis, means confliction. So I never believed in diagnoses, you know. So yeah, here we are now. You know, thank God for the evolution. Thank God for every bad thing that has happened to our society. I like to turn it around and make it positive.
Yeah, there's definitely been some more shifts in awareness and people, you know, asking more questions and advocating for their health instead of just taking whatever their doctor says as face value. Get a third opinion.
Exactly. Go look up on the internet. Go do your own research and really aware yourself, not just because some HMO doctor tells you, well, you know, you're diabetic, here's some medication. Well, why am I a diabetic? What is it in my life that has caused me to be a diabetic? Is it diet, which 75, 80% is it chronic issues in my system? So do your research, follow through. Don't just believe some guy who you don't know that works for some HMO, you know, practice tells you, well, you know, your blood level says you're diabetic. Thank you so much. You know, there was an amazing research done a few years ago. They took 50 patients from the United States. They took their blood levels, CBC, what have you, and they sent that out to 20 different medical doctors all around the United States. And they looked at the results. 5% were pre-diabetic, 6% were pre-anemic, blah, 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 blah. They take the same results and send it out 20 doctors in Europe. 80% were pre-diabetic, 75% were pre-anemic. So again, we have to be able to read, as a physicians, we're supposed to read between the lines. Absolutely. Yeah.
So getting back to dental health, I want to talk a little bit about the connection of what's going on in our mouth and what, a lot of people are suffering from autoimmune conditions and chronic conditions like Lyme and Epstein-Barr and mold and things like that. What sort of connections do you see in the mouth and dental health in relation to some of these chronic conditions?
I believe that dental challenges, your teeth are true barometers of your health. If you come to me, hey, you were at my office yesterday. Hey, Dr. Pana, I had this little decay, which we observed during when we did your cleaning. Where's this decay coming from? Of course, I have to remove that decay properly with most gentle way possible.
It didn't even hurt. No numbing.
Aeration, proper drilling, what have you, and put a nice, proper filling material in there. But my question is, what's going on within your system that now suddenly out of nowhere you have this decay? I've been seeing you for the past 10 years. You haven't had one single decay. And now I'm sorry, I have to use you as an example.
No, it's fine. I'm always an example.
Yeah. And suddenly you have this decay on one of your upper left molars. Of course, we used air abrasion, no drilling. We removed the superficial part of the decay. We used ozone to oxidize it and clean it. But my question was, why out of nowhere you have this decay? As I looked further into that tooth, we saw areas of decalcification. So there's something going on in that tooth as it relates to your organ that's causing that short circuit. So what did I advise? Get your electrolytes, get your minerals, see me back in 1 month. It was that decalcification due to the short circuit of what was going on in one of your organs, which that tooth is connected to your gut, that caused that bacterial biofilm to attack your tooth. So teeth are true barometers of one system. From this little issue, we found out that there's some stuff going on with your gut.
And that totally makes sense because I did have to take some antibiotics last year, which I don't usually ever take.
Yeah.
And we know that antibiotics have a huge impact on your gut. So to me, it was super clear. It makes sense that there's that connection and that I do know I need to do some work on my gut after the antibiotic exposure.
Now, any other dentist would say, oh, yeah, let's put a crown on that tooth. There's some decalcification. Let's shave that tooth, put a crown on it. And we know that 87% of all teeth that get crowned end up needing root canals. And that's the last thing I want for a patient of mine that has been dealing with, I hate the word Lyme disease, the Lyme challenge. So above and beyond me having to be a great restorative dentist, I also want to take that extra step finding out why. Why? If I can help you with that why, we'll put a stop to that issue. If not, drill it, fill it, bill it, and then guess what? You'll be back in 6 months with another tooth that needs the same work. Some dentists might find that to be interesting. Well, I'm going to make more money. Money comes, money goes.
Yep, absolutely. So let's talk about root canals because that is such a heated topic. I feel like so many people have had them. There's such a correlation to chronic conditions and like even cancer. They say that, a lot of people that have cancer had a root canal at some point in their life. So what is exactly a root canal and why is it so detrimental to your health in the long run?
Do you want the short version or the long version?
So we do the medium version.
So the medium version, okay. All right. So you have a tooth. Imagine every tooth as a mini organ. Every tooth has an artery, vein, nerve, and lymphatic connection. So literally every tooth, it's a organ. Now, due to different reasons, trauma from clenching and grinding, tooth decay, faulty fillings that broke down or wasn't done right, this bacterial entity, and we can talk about that later, which is basically biofilm, attacked the nerve and killed the nerve. So what did the dentist do? Well, they remove all the nerve, artery, vein, all that tissue out of the tooth, and they put a filling in there. So you have an entity that used to be oxygenated, had lymphatic, neural, arterial, and venous support, and now it's nothing.
So it's a dead tooth, basically.
It's a dead tooth, basically. So in our saliva, in 1990s, we were taught there's 350 different types of bacteria all the time in our saliva. You brush, you floss, you rinse. Within 60 seconds, all that comes back in. And it really, that is correlated to your milieu, your overall health system. Well, fast forward 20 years, those buggers is actually not 350 different types of bacteria, over 2,000 different types of bacteria, virus and fungus. They live in these colonies called biofilm. Anybody that's dealing with the Lyme challenge, not Lyme disease, Lyme challenge knows biofilm. We know that biofilm hates oxygen. And if you go on to University of Montana, www.erc.montana.edu, that's the engineering department for biofilm. If you study biofilm, it's like an alien. It's so smart.
Wow.
It's been here before the dinosaurs were here. Biofilm hates oxygen. So they get attracted to areas that there is no oxygen, such as a root canal. Now, take that and add pH factors to it. We know that as we go through our healing crises, our body becomes acidic. That promotes and activates that biofilm even more. So the biofilm loves to go and gets attracted to these root canal teeth. Think of a tooth as a sponge. You have about 6 miles of tunnels that live within a single tooth.
Wow.
So they go deep and embed themselves into those tubules. So your body is now like, wait a minute, there's a dead tissue, there is biofilm. We know all living organisms poop. Your dog. The poop from biofilm causes an immune response. So that little root canal becomes a burden on your immune system. That is the basic of it. Now, more research is showing us that the poop from biofilm is actually an endotoxin. So now you have an entity, now your body is harboring this entity
colony
that it can't get rid of.
Yeah.
We know that health is, the gain has to be more than the loss. But when you have these burdens, such as a root canal, mercury fillings, whole nother story, cavitations, whole nother story, you are disturbing that flow. You have more loss than you have gain. So it becomes a burden on your immune system, a chronic issue. And we know that chronic issues are the common denominator to autoimmune issues. I just got off the phone with one of my best friends, first friend I met when I came to the States. What are you doing? I just got a root canal. After I leave here, I'm going to his house, I'm going to grab his butt, take him to my office and take that tooth out. And this guy was a skinny little guy. This is his 4th root canal. And when he started this canal, he's not like he's fat, but he's inflamed.
Inflammation.
Because his body's constantly dealing with this. He was a perfect fit, his muscle mass, now he's got this big belly going on, he's all swollen, because his body is dealing with these 4 freaking root canals.
Yeah. So what do you do if, say, someone before they knew better did get a root canal? Is there work that you can do afterwards to help clear that out? Do you have to pull the tooth, or like how do you kind of salvage it? And what if you get to the point that you say you have this like dead tooth, right? Is there a safe way to do a root canal, or what are the alternatives for it?
Very good question. A complicated
and it's a lot of questions
question,
at once, right?
But very good question.
It's all tied together.
You know, at the end of the day, my job is to advise my patients on their choices. Again, thank God for the internet. You can go Google root canal toxicity. There's articles, there's even a movie about it. even the American Dental Association, the American Heart Association, I have the research on my website that specifies, especially with our female patients, after menopause, any kind of dental issues is a common denominator for cancer. So if you come to me, my tooth is dead, I have a root canal, my endodontist tells me, and the tooth is abscessed, I got to redo that root canal. I start laughing. It's a waste of time, waste of money. There's no good prognosis on that.
What do you do?
Remove the tooth properly, clean everything out, put a bridge or an implant or a partial, whatever suits your lifestyle. Because we know that redoing root canals, it's a scam. I'm sorry I have to say this. Sorry about all the endodontists out there. It's a scam. We all know it's not going to work. Remember, I told you a tooth is a sponge. When it gets abscessed, when those buggers go deep within those tubules, there's no way to get it out. There's no way to get it out. Now, if you come to me and we know that this tooth is about to die. Now, you have your tooth, you have the roots. The roots are embedded in the jawbone. Between the roots and the bone, there's what we call a periodontal ligament. It has a lot of neural connection. 78% of the blood supply that comes to that tooth comes from that ligament. You know, when you bite on something, suddenly your mouth opens because it doesn't want to fracture your tooth. That's because of the periodontal ligament. So if you come to me and we know this tooth is going to die.
What are signs that a tooth is going to die? How do you know that's
sensitivity, extreme sensitivity to hot, cold, biting. We know this tooth is, see, if I sit here and punch your arm, 1, 2, 3, after a while it's going to get red, a little black and blue, and it's going to swell up. Hey, doctor, don't touch me anymore. It's going to swell up. And the swelling will go down. When teeth get traumatized, they can't swell up.
So just get sensitive.
The nerve says, you know, I can't handle this. The nerve dies. And that could be due to a variety of reasons. So if I know this tooth is going to die, I'll get you to one of the most advanced endodontic doctors. Remove the nerve, remove the artery, remove everything, ozonate it, laser it, put a filling in there, and try to preserve that periodontal ligament. That's a healthy root canal. But it's quite rare to see because by the time my patients get to me, the tooth is abscessed, the nerve is dead, there's already a periapical pathology going on. Now, again, my job is to give you your choices. So I have patients that come to me, listen, there is no way in God's name, and this is mostly the actors and actresses that come to me say this, there's no way I'm going to remove this tooth. What other options do you have for me? Well, there's only two things that subside the biofilm. Clorox, well, I can't inject Clorox into your body, or ozone. So we do what's called the X-tip method, which we kind of poke a hole in the bone. And remember, our jawbone is like a bone marrow. Hard bone on the outside, soft bone on the inside. That's where the roots of the root canals and the teeth are. So I create a port into that area, and I just inject ozone, proper amount of ozone, not too much, not too little, to subside, to oxidize the biofilm. Of course, these patients have to see me every 3 months, every 6 months. As the biofilm rebuilds, I inject, they go down. But I tell you, Erica, every one of these patients, after about a year of going through this, they're like, you know what? I'm done with this. Just take the tooth out and give me an implant. Why? Every time you inject ozone, I feel different. I feel more free. So at the end of the day, my job is to advise you. I'm not one of those wannabe biological. They say, oh, all root canals have to come out. No. You know what? You do what you need to do for your body. I'm here to do the best job for you, and I'm here to advise you on what to do next. Yeah,
makes sense. And then, so let's talk about cavitation. So you brought it up, and anyone's been following me for a while, you've probably seen on my blog that I had cavitation surgery, and it made a really big difference for me. I did it with him, and it made a big difference. You know, it was like very interesting. I used to have this feeling like when I would go down steps that it was almost like this hollowness in my jaw, and it was so weird. After my surgery completely went away, anxiety went way down. Like it was just like I had something in there that was affecting me so much, and
Well, let's take a step back.
Yeah.
Okay. So you had this, and we did the pathologies, we did, and you spent
all sorts of nasty stuff in there.
And you spent arm and a leg on not just the surgical part, but the pathology and the laboratories to see what's in there. And all
I
that
wanted
stuff.
to know.
Yeah. First and foremost, that entity, that issue was a chronic issue on your immune system. Yep. So how did your immune system deal with it? Well, adrenals, thyroid. Some people increase blood pressure because the body has constantly fight that. Anxiety, we see it with all different types of dental issues. So that's the first part of it. So that was what was affecting you systemically on keeping you on a fight and flight constantly.
Yeah. I had this new calmness afterwards. After I finally recovered from the surgery, I was like, I feel so calm. It's like, what is this feeling? It's really nice. I haven't felt this in so long.
I've never felt that before. It's like when you're parasympathetic. A lot of our patients out there is like they're sympathetic, parasympathetic have crisscrossed. It's like the yin and yang has crisscrossed. It's like the body has to fight for itself to stay alive. So when they get the sense of that parasympathetic, they're like, hey, doc, I don't know why I'm so relaxed. What's going on? Because you're parasympathetic. They're not used to it.
Yeah, it is a new feeling for sure.
It's a new feeling because your body's been fighting every day for that. So that's the first part of it. And don't get me started on the viral, fungal, bacterial.
All the stuff that's living in there.
And it's constantly spreading into your system.
Yeah.
So cavitations, again, cavitations, I've said this before and I'm going to keep on saying it. After being attacked by Quackwatch for so many different, and that's another podcast.
A whole other
Cavitation
episode.
is not a scientific term. Okay? It's not a scientific term.
What is the scientific term?
NICO.
Okay.
It's basically what we find in these cavitation sites is very close to gangrene bone. Now, how did this happen? Variety of different ways. One, the dentist popped the tooth out and he was so glad to get the whole tooth out that just put some gauze, bite down, and I'll see you later because I didn't break the tooth. I didn't, fracture the tooth. I don't have to send you to an oral surgeon. But he left the periodontal ligament that we talked about, which is a live tissue. Pieces of fibers of the tooth, all were left behind and the body closed over it. So those live tissues, the periodontal ligament, the fibers are live tissue that become decayed and eventually cause a infection. That's one part. Second part, the doctor took the tooth out, and what we see because of our epigenetics and humanity and all of that, we know that our jaw is not able to support 32 teeth. So a lot of the wisdom teeth are angled. And that angulation causes bacterial trap and infects the bone. So if the tooth was removed and that bone, that infected bone was not removed, well, that infected bone stays there, grows and grows and grows. That's another way you can get cavitations. Third part, you had some blood clotting factors because you're a 14-year-old little girl that were just placed on birth control pills because your periods are just driving you crazy. You went from this straight A student to this rebel now, so the hormones is not working properly. They have you on birth control pills. The blood clotting factors and hormones go hand to hand, and blood clot factors were not there properly, and it didn't heal properly.
That's interesting. So that's like people don't even put that connection if you're like, being on birth control or hormones to your dental health.
That's another podcast.
Yeah,
which
absolutely.
We're gonna love.
Absolutely.
Actually, that goes back to braces.
Yeah.
how they take this teeth out, condense the jaw, completely mess up your TMJ joint. And I know we're going kind of off the track, but your TMJ joint has more hormonal receptors than any other part of the body. When you start messing with that, that's when you start getting hormonal issues. And what they do, they give you some birth control pills. And you should be okay. You should be controlled.
It's always just a pill that's going to fix one thing and tweak everything else, right?
Diagnoses.
Yeah, absolutely.
Okay. So there's a variety of ways that you can get cavitation. At the end of the day, how do we deal with it? Well, it all depends on the size. If there was something left back, like the fibers, tooth ligaments, piece of tooth. So every patient is a little different. And at the end of the day, I would say 80% of these cavitations have to be dealt with surgically. That means you got to go in there, remove all the infected bone, and truly you need advanced surgical training into these things. And above and beyond the surgical part, there's a systemic part. You got to make sure the body's ready.
Yep.
You probably spend more money on being prepared for these surgeries.
And it was
actual
still hard
surgery.
for me. It was still hard for me to recover, and really affected my lymph. And that was like a big thing afterwards, is just getting my lymph to drain properly and not be so swollen. And then once it did, I was like, that's when I really kind of turned a corner and made a big difference. But
absolutely.
Yeah.
Absolutely.
Even with all the prep in the world, like it's still a challenging procedure.
It's really interesting that I get phone calls now from different doctors. Listen, this patient has a live tooth and there's cavitation underneath it. How is this possible?
How is that possible?
At first, I was like, what do you mean? But remember, biofilm, lack of oxygen. So my theory is, and I probably would need a couple of $1 million to prove this, but my theory is that when we know that through dental body chart, every tooth is connected to different organs. Right? Just like your tooth that has this decay out of nowhere, this decalcification connected to your gut. So we know it's a gut issue that's caused that. So there's a short circuit. So my theory is that when these organs, especially organs that are very prone to our detox pathways. I mean, your gut is your first line of defense. You have more lymphatic connection in your gut than any other part of the body. So when the gut is not working well, it's going to cause a short circuit to the corresponding organs and teeth. That corresponding negative energy, that short circuit, allows biofilm to attack. Biofilm is sitting there. Where's a place I can go that there's no oxygen? Because I love areas that there's no oxygen. So it attacks. But those cases are really easy. Proper ozone and plasma-rich fiber, which we derive from your blood, heals them perfectly. But at the end of the day, let's go back to the gut and get that gut healed, which most people don't understand.
I feel like the gut is a root thing to work on for any condition, right? And then everything else is so connected to it.
The more and more I dive into this gut health, the more and more I see what an important part is our first line of defense.
Absolutely. I mean, if you think about it, it's like, your mouth, down your stomach, it's like one layer of skin practically that's connecting your outside world to your inside world.
Absolutely.
And taking care of everything that's coming into you.
When I'm walking through, I travel quite a bit. When I'm walking through airports, when I'm walking through malls and I see people with Cheetos and McDonald's, I'm like, did you see that research on McDonald's French fries having 14 different ingredients in it? How could you still eat that fries?
Or my favorite are the ones, the pictures of it like 15 years later and it hasn't even decomposed or gotten moldy. It's like, plastic.
It's like, I want to go up to these mothers but have their kids with red hands and Cheetos. I'm like, that red dye is going to kill you? They look at me like, who are you? Well, I'm Dr. Panahpour. I've done my research, So, yeah, it's a crazy world.
Yeah.
It just drives me crazy. Like, right now, I moved to Mexico about 8 months ago for different reasons. And it's so hard for us to get organic food there.
Oh, really? Interesting.
Very hard. Most of the stores that open up, they either close down because people can't afford it. So I literally have to buy organic food from El Paso, put it in the freezer box, and bring it down to Chihuahua, Mexico.
Have your own farm, start your own farmland.
Don't get me started on that either. That's a whole different story. Yeah. But meat, chicken, organic, no problem.
That's easy.
Fruits and vegetables, very hard.
It's time to go on a carnivore diet then for a little bit.
I love the carnivore. I'm blood type O.
Me too.
I love the carnivore diet.
I go through phases where I'm just
I'll chop
carnivore.
it, marinate it, glaze it, and barbecue that baby. Yeah.
Absolutely. So I want to end on a little more mild note, but cosmetic dentistry is such a big topic right now. You know, people are getting teeth whitening and veneers and all these things. What's your thoughts on these things? Are there any safe ways to do it and kind of improve your teeth and smile without damaging your teeth and having one of these more serious conditions with your dental health down the road?
You know, most of the tooth whitening products out there, basically there's a gel, hydroxyapatite or some sort of a solution that they place on your teeth. They activate it now with different lasers. And this activation causes a color change, but at the same time, it's sucking the minerals out of your teeth. So if you got to go to a wedding, family picture, yeah, go ahead. Do a little whitening one session, but you know, we as Americans, you know, if one vitamin C is good, give me 20.
Yeah, so people just don't stop, right?
The first day, oh, I love my teeth. But after a few days, week, their eyes kind of get used to that. So they want it whiter and whiter. And before they know it, why am I having sensitivity? Well, because that product has sucked the minerals out of your teeth. So it makes your teeth from being strong to porous. So that I don't recommend. Now, there are new advancements with using ozone that's coming. I'm kind of playing with it right now. So that's as far as tooth whitening. Don't overdo it.
I'll wait for the ozone one.
Wait for the ozone one. You know, and we know that what stains your teeth? Well, food. Anything that has color will stain your teeth. Coffee, tea, anything that's color will stain your teeth. I did a tooth whitening years ago for a patient of mine. Saw them at the 31 flavor that afternoon, going at a chocolate cone ice cream. I'm like, dude, you just paid $800 to get your teeth whitened. Now you're having these chocolate, fudge, maja, coca, whatever. Like, thank you so much, you know?
Wait, why were you at 31 flavors?
I love my chocolate. I love my chocolate. Let me tell you. Actually, I was just passing by. So as far as cosmetic dentistry, you know, teeth are very characteristic of who we are. And through our evolution, humanity, we know that our facial structure and the way teeth are not going hand in hand. That's why people get braces to create that picket fence, what have you. But at the end of the day, I don't believe in shaving teeth, because in order for you to put a veneer on a tooth, you have to shave a tooth. So shaving maybe 0.5, 1 millimeter of enamel, it's fine. But when you overdo it, yeah. But at the end of the day, remember, hence the word craniosacral. Your teeth have a lot to do with your posture. So if your shoulders are off, your hip is off, you have this forward head posture, and you will get full mouth reconstruction done, it's going to fail. So get your body straight, get your craniosacral in harmony, and look at your options. We want to be able to conserve as much tooth structure as possible. You shave a tooth, you're not going to get that tooth back.
Yeah.
So I have a lot of patients that come to me, I want veneers all around because I saw a picture of Paltrow or whatever, and I want that picket fence. Okay, well, there's a few steps we need. Oh, no, I want it around because I have to do a wedding tomorrow. I'm sorry, I'm not the right place for you. Yeah. So I believe in cosmetics. And I was a cosmetic dentist. I did a lot of celebrities in my younger days. Jennifer Lopez, Halle Berry, all these used to come to me. But at the end of the day, what you do with your teeth, you can't reverse it.
Yeah.
So if you shave a tooth down to put this beautiful veneer, know the consequences. So there's always other options, such as biomimetic dentistry.
What is that?
Add before you remove. Conserve that tooth structure before you remove.
So how do you add before you remove?
Well, through bonding.
Oh, okay.
Through bonding.
So you put like a layer on top of it?
How do we see each other?
Yeah.
Reflection of light. If I'm able to alter that light through simple bonding, then I've done a good job. So just don't jump into shaving every teeth, because every patient that has done this has had temporomandibular joint issues, craniosacral issues, headaches, etc., etc.
Crazy.
So there's always options out there. But again, we live in Hollywood. Everybody wants that beautiful picket fence, which I'm not too really excited about, because again, your tooth are it's characteristic of you.
It almost doesn't look real, right? Like when you see it, like it looks good, and then you're just like, but it looks so fake at the same time. Like
I had a patient
kind of a catch-22
right
with it.
Before I came here. We're doing an expansion for her. And now, because of the expansion, she has a little space between her front teeth. She is so happy. She's like, I looked it up. Madonna has this. This actor has this. I'm like, yeah, it's freedom.
Yeah.
She was so excited. Everybody else will be, no. Bigger crowns, close them up. So.
Awesome. Well, Dr. Panahpour, thank you so much for being an amazing guest. If people want to find you and find out more about you, how can they find you? www.systemicdentist.com. And all you got to do is these days, just Google me. I'm on YouTube and social media and what have you. And we'd love to see you guys. Yeah. And we'll link to everything in the show notes as well. Amazing. Thank you so much.
Thank you, Erica.